This is now allowing the theatres of this hospital to provide urgent care and the type of care it couldn't provide before, because now the two theatres can run separately, and a lot of services that couldn't provide it before is now being able to provide it. So even smaller projects like this is very important for us as Public Works to get right, because this helps providing the excellent services that we want to give to the people of KwaZulu-Natal, not only in this district but across the province. And I'm very proud of what I've seen here today, that our department is really improving, and we're getting a department that we and the people can be proud of.
Besides the visit here in Murchison, where other hospitals did you visit?
Very recently, we're in RK Khan Hospital in Chatsworth, in Durban. We're just busy completing that project, and this is actually the start of a series of visits across the province. We'll be visiting projects, not only health department projects, but all projects of the department. But I'm quite interested to come and see to the health department projects, because I firmly believe that we can build hospitals that you can't tell the difference between private and government hospitals, because it's our job to provide a service that people can be proud of.
Just maybe to explain to us the cost of the project.
The project at the end cost just over 5.7 million. There was a slight overrun, but it's because the equipment had to be imported from Germany, and it took some time to get the equipment there. So of course there was a time delay. That means a slight overrun in the cost. So overall, we're actually very proud that we weren't too far over the budget and not too far over the time. And the period that we were over time was actually because we were waiting for the equipment to come from Germany, which also, as I said earlier, inspires us that we need to start building factories so we can build these things in South Africa and don't have to import them anymore.
Thank you so much.
Thank you.
Good day. I'm Dr. Sunlata Lakshman, Sunny Lakshman. I'm the medical manager at Murchison Hospital. I'm acting CEO currently. So the project that we've done, that's just been completed, it's our new theatre chiller. So basically it's keeping our temperatures cool in our theatre. It allows us to do optimal operations. So while we're doing mainly cesarean sections, which is for maternity cases, we're now able to do orthopedic cases as well. Faster turnaround time for our patients, getting them mobilized, getting them back on their feet, back into the workforce. So that's a big game changer for us. And we're hoping then to increase our operational base at Murchison Hospital. What I've also spoken to the MEC previously about was some of the older infrastructure within the hospital that we would like to be upgraded, especially our outpatients department and our casualty department. They're very small for the patient load that we see. Murchison is an area where we have a lot of trauma and assault cases that come in. We're on the N2, a lot of MBAs, accident cases. So it can get a bit busy, can get crowded. So a bigger space would be appreciated, especially for the more specialized types of cases that come in. Cases that are infectious, cases of GBV or sexual assault. We need to see patients privately, offer them that confidentiality, respect, what has gone wrong with them. So those cases, like pediatrics as well, we need a bit more specialized in terms of how we resuscitate those patients. So that's what we are looking for. Also, our outpatients department, it's one of the oldest in the district. Doesn't offer that much patient confidentiality, infection control as well. So yes, that's what we've been asking. So it's promised to help us. Let's see where we go from there.